We're going to discuss now a big step towards addressing America's opioid crisis. The FDA approving the opioid overdose antidote Narcan for sales over the counter. The drug will soon be available on the shelves, potentially saving thousands of lives. CNN's chief medical correspondent, of course, is Dr. Sanjay Gupta. He joins us. Good morning, Sanjay. What kind of impact could this decision have?
Well, Don, since we've been reporting on this over the last 2 decades, more than 1 million people have died of drug overdoses, and the majority of those have been opioids. I mean, people have been hearing these numbers for some time, and the numbers have been getting worse. I mean, in 2020, you had some 69,000 people who died of opioid overdoses specifically. The numbers have gone up since then. Any strategy that could potentially be helpful is what people have been looking for. And Narcan is essentially an antidote to an opioid overdose. It can block opioids from actually killing you. Right now, as things stand, Don, you can get Narcan in any pharmacy in the country. There's these access laws that allow you to get that without a prescription. What this is going to do, and this will be by end of summer, is allow the Narcan to be purchased over the counter. So in the same place you buy your Tylenol or allergy medications, things like that, you could get it there. So would it make it more likely for people to buy the Narcan, put it in their medicine cabinet, have it ready to go should some terrible overdose happen? That's the question. And the idea that that could have an impact, I think, is pretty strong.
Yeah, but you have to know how to use it, Sanjay. Can you walk us through how that works?
Yeah, yes, absolutely. First of all, you have to recognize when someone is in the throes of an overdose. You want to give this right at the beginning of an overdose. This is a nasal spray, so you're just going to put it in their nostril and you're going to squirt the plunger. But recognizing that someone's in an overdose is pretty important. So things like small constricted pupils, that's what opioids do. Other drugs like stimulants, alcohol, cocaine, mescaline, things like that, ecstasy, that will cause your pupils to be dilated. So small constricted pupils, that's a good sign it's an opioid overdose. Obviously, someone who's falling asleep, you can't wake them up, they're not conscious, the type of breathing may be different, all of those types of signs, that'll give you an indication someone's in an overdose. Then basically you put that plunger in, they don't even have to be fully inhaling, and you just squirt that in there, and it can work very quickly. You still want to call 911. You still want to get emergency personnel involved, but that is an opioid overdose rescue scenario that I've just described, and it can be done pretty quickly, just frankly, by anybody.
Yeah. Well, and that's something we've seen emergency workers use and people have in different places. Sanjay, when it comes to drug overdoses, what are other strategies and things that people will do when it comes to deaths if they don't actually have Narcan or something available to them?
Well, one of the big things that we're seeing, I visited this DEA lab recently, Caitlin, and what we found is that they're employing all these different strategies, even in the field. So someone who is a drug user, and this is harm reduction, meaning that it's an acknowledgement that these drugs are being used, let's reduce the harm as much as possible. They are starting to advocate for test strips, for example. 99% of the illicit drugs that are currently being seized have fentanyl in them. It's remarkable. I mean, something we barely talked about a few years ago, and now all the illicit drugs have fentanyl in them. If you're not, and that could be in your Adderall, it could be in your anti-anxiety medications, places where you would not expect it at all, they could be tainted with fentanyl. So one of the strategies is to allow people to start testing for this. Test strips, making them available in the field, so you could test your drug ahead of time for fentanyl, and also for other things like xylazine, a sedative drug. That is being used now to taint a lot of these drugs. So that's another strategy as well, Caitlin.
Yeah. Wait, sorry, can I just follow up on that? You're saying it can be found in people's Adderall and other drugs that people use. These are prescription drugs people are getting from their pharmacy, or how is that? How does that happen? How does that work?
No, I want to be clear on that. Illicit drugs, okay. So people who are buying those types of drugs on the street. I don't want to frighten people. I think if you're getting your drugs from a bricks and mortar pharmacy, that drug supply has generally been safe, and luckily, thankfully. It's the illicit drugs, and there are lots of illicit pills out there.
Hey, Sanjay, we're up against a clock, and you know how this works, but just quickly, what if I'm wrong? What if someone I think they're overdosing, and I give them Narcan, and they're not overdosing? Is there a danger there?
That's a good question.
Great question. No, there's not. I'll answer that simply. There's not a problem with giving it. If you're in doubt, you should give the Narcan.
Okay. Thank you.
Always learned so much. Thank you so much, Sanjay.